A lot has changed in a year, including the COVID-19 coronavirus. About a year ago, health experts were advising the general public not to buy N95 face masks to protect against the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. But things have changed since then. Now countries in Europe are beginning to mandate the use of medical-grade face masks like N95, KN95, or FFP2 or FFP3 respirators. Here FFP stands for filtering facepiece and not flying feral pig. Countries in Asia are mass-producing such face masks for the public. And the US? Well, there's talk of recommending such respirators for the general public rather than just standard face coverings. So what has changed? Well, back in the early days of the pandemic in US, the advice to not buy and hoard N95 face masks stemmed mainly from the fact that such masks were in short supply in the United States. Yes, in March 2020, they were even harder to find than toilet paper, if you can imagine that. Many healthcare facilities didn't even have enough N95 masks for healthcare professionals such doctors and nurses because they hadn't maintained adequate reserves. Healthcare facilities not having enough personal protective equipment (PPE) would be like bathrooms not having enough, well, toilet paper. At the time, it was also assumed that the COVID-19 coronavirus was transmitted more like the flu virus, mainly through large respiratory droplets and close contact. Large respiratory droplets typically do not travel further than 6 feet because of their size and something called gravity. 6 feet is about 1 Denzel because Denzel Washington is about 6 feet tall, or 1 Gosling for Ryan Gosling if you are in Canada. However, since the early spring of 2020, a small finding turned out to be a big finding. Besides bigger respiratory droplets, smaller respiratory particles carrying the SARS-CoV-2 could come out of your nose and mouth as well if you are infected with the virus. These much smaller droplets could float in the air longer and further because they are lighter. In fact, research has found that these particles with viruses can come out of your mouth even when you're doing something as simple as talking and saying something like, "Thanos is thick." This finding prompted public health experts to begin recommending that members of the general public wear face coverings to block these smaller particles. That's because simply staying 1 Denzel away wouldn't be enough to avoid what could float for several Shaquille O'Neals or hang in the air for a while. Face coverings could reduce the number of such particles coming out of a person's mouth even if he or she were singing Sia's Chandelier. Of course, N95 masks have always been better at blocking viruses from entering or leaving your nose and mouth than standard face coverings like a cloth mask or a surgical mask. They could also protect you better against breathing in such particles.